Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with Nassau Community College student Gina Peter. And today we're going to get a much needed update on the COVID-19 pandemic and how it is affecting hospitals here on Long Island.
Our guest today is Dr. Frederick Davis, the Associate Chair and Physician in the Emergency Department at Long Island Jewish Medical Center, which is part of Northwell Heath.
Dr. Davis, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Well, thank you. Thank you for having me.
So I hope you're doing well in light of the COVID-19 pandemic. Has the virus affected you personally?
I've been fortunate enough to be spared at this point, but I think it's hard to say it hasn't affected me directly. If it hasn't affected me physically, I think emotionally and the stress of having to deal with the number of patients or the populations we treat definitely has.
So can you tell us a little bit about yourself and what made you want to get involved in emergency medicine?
Sure. So I actually, after graduating from college, I actually wanted to do something that involved helping people. And I actually went into, for a while, Eastern medicine. I actually studied a little bit of acupuncture and then found myself in an emergency department at nights working as a tech, which is basically like an EMT in the emergency department. During that time, I really fell in love with what emergency department, emergency medicine really was. It was a place that was there 24/7, 7 days a week, holidays, and was just open for anybody. It didn't care who you were. It didn't care if you had insurance. It didn't care if you were young, if you were old, if you were having a baby, if you had an infectious disease, as we currently see, or if you came in after a car accident. It was there to serve everybody. And for me, that was something that really was a calling and said, oh my God, I would love to have the skills to do this. And so I went back to medical school and became an emergency room physician.
So we're recording you in the middle of November 2020. Where do we stand right now when it comes to how many people are hospitalized with COVID-19 at Long Island Jewish Medical Center?
So we're at a good place right now, especially when you compare to what was March. Definitely a lot better than then. We are starting to see an uptick, though. I think as the weather has changed and there has been that sense of mass fatigue that has gone on in New York, I think we're starting to see the numbers start to slowly increase. What's been part of that, I think, has also been the weather has brought people closer inside. Holidays have brought families again back together, which I think has also provided its own risk of different populations now being exposed to the illness.
How many patients did you have at the peak of the pandemic in March and April?
So at the peak, we actually were a hospital that normally sees about just over 500 patients, 550-something bedded hospital. At one point in time, we swelled to 902 patients in our hospital. That included, and the majority of them, I would say 99% of them were COVID patients. So that involved converting whole wings to COVID areas, converting ICUs to COVID areas. So there was a lot of patients that we were caring for outside our normal capacity. But we managed to bring in staff from nursing to physicians, from outside resources as well to help deal with that. And Northwell Heath as a health system really worked together to really bring in the forces that are needed, both from the patients that get them to where the care they could get and bring them into hospitals within the Northwell system that wasn't as inundated, but also to provide and moving around specific care providers so that we can provide the care as surgeries close, moving some of the surgeons back into the hospital to care for patients within the hospital as opposed to outpatient settings.
So how are you concerned at all with the near peak? Is this considered the second peak, would you say, or the first peak? How do you define this?
It's a great question. I think, we're definitely starting to see a second wave, but I can see how it's really linked to the first one, because New York was, for the most part, the first place to really see COVID-19 in the United States. And I think that as other states started to see the rise, we're starting to see the fallout of that. We did very well over the past few months to kind of bring those numbers down to, really small percentages. We were at, 1% at times and even under 1% for different areas of New York State. As other states start to rise and we have people crossing state lines or traveling and coming back to New York, I think we started to slowly see the increase to the point where, our numbers are starting to slowly tick up. It's definitely not where we were, but I'm concerned that there is that cusp, that second wave is among us, especially as we enter winter and enter the holiday season.
So tell me, how does this work? Now, if I am positive COVID and I have quarantined for the 14 days, do I take another COVID test after the 14 days, or am I getting an antibody to see how high that antibody is as to whether I should come off quarantine or stay on quarantine? How are we dealing with the numbers and the tests?
I think it's a great question. And I think as we learn more, a lot of that recommendations change. I know initially a lot of the data out there was even suggestive of without testing, just the quarantine, because there weren't as much access to testing. Now that there is access to testing, it really is getting that second test to show that you don't have active disease.
When?
And that second test after after the 14 days have been exposed to it. The other question comes in is really your symptoms too, because if you're still symptomatic, there will be some recommendations, to continue on some sort of quarantine until those symptoms resolve. Because while 14 days is a great number, it comes with the average. That's how likely the course is of how much time is usually spent on where you can pass on the disease. But that doesn't mean everyone at 14 days all of a sudden doesn't have a disease or doesn't pass it on. There are people who go longer, and that's why that second test is important to say, are you still having active disease and can you still spread this disease, to say, okay, you're safe enough to go back to your normal routine.
Do you agree with the mandates that have been put in recently to enforce like curfew with businesses closing early? Does that help in your opinion?
I think a lot of these mandates and a lot of the suggestions by the state go in with good reasoning. I think it's always tougher to enforce, without having additional forces to be able to do these enforcing. I think it's really tough. I think it's a good idea to have people to reduce any kind of unnecessary gatherings, to reduce the amount of people that are in close contact will really help reduce the disease. And I think when we started opening up businesses, there were a lot of more of these slow outbreaks related to gatherings, and whether that was related to restaurants and bars and so forth. The reality was it was just people gathering in small areas where masks were off. And if we can do anything to reduce that exposure, there will be less of a increase in the rise in numbers that we will see. So it's tough to say if that alone, a curfew, will make that much of a difference. But if we can say, oh my God, how important this is that they're really looking at this and try to reduce all our risks in every aspect of our current life, I think that will go the longest.
So I have a threefold question. First, what is the treatment? And are you, after being tested positive for COVID-19, is that a hospital stay? And how long typically is the hospital stay before someone is sent home if they are positive COVID?
So most of the treatments are still very much supportive. Many times if someone comes in and they basically test positive for COVID, it all depends on what the extent of their symptoms are to say whether or not they need anything further as far as medications, or if they need admission to the hospital. So a typical patient that might come in and let's say they have a cough and a fever and they test positive, and really the only thing they have is a cough and a fever, that their oxygenation is not something low. Normal oxygenation is any, upper 90s to 100%. If they are at that and they have no other concerning factors, they go home and they usually go home with no medications with the support of Tylenol and Motrin to continue as needed for the fever. However, that same person that comes in with the fever, with the body aches, and then you do a pulse ox and you find out their oxygenation is 80s, that's not something that's good. And so they usually will need supplemental oxygen. Those that require supplemental oxygen, there has been data to support right now that steroids such as dexamethasone is beneficial and helps reduce some of the long-term effects and some of the exacerbations of the respiratory distress syndrome. So we would give steroids. There's current studies going on to find out if remdesivir is beneficial for these lower risk patients. So currently there are a lot of people that do get admitted to the hospital will also be put on remdesivir, which is an antiviral medication, which has been shown to cut the number of days within a hospital. Hasn't really been shown to necessarily improve mortality or morbidity, but just shows that people who aren't too sick might get better a little bit quicker on it. And those usually are the extent of the interventions that are needed for most people. Those that come in that are severely sick, such as what we call respiratory distress, meaning they're having difficulty breathing, their oxygen saturations aren't getting better with things like a nasal cannula, supplemental oxygen. Those are the ones that need. We've recently been able to do what they call BiPAP, which is a non-invasive procedure where they put a mask on you that blows air in. However, if they don't improve their oxygenation at that point, then they get intubated. Obviously, people that need any supplemental oxygen or need intubated, which is a tube down the throat to help them breathe, those are people that stay in the hospital. Currently,
at your hospital, do you have COVID units where only those patients who have been diagnosed with COVID, they are only on that unit? Are you cohorting them or commingling them with other types of patients? How are you handling the COVID patients right now?
So I think we've been very good about making sure every patient that comes into the hospital gets tested. And before a test is back, they're treated as a COVID patient until proven otherwise, meaning they're in a sense of isolation, single room, until their test comes back. Once their test comes back, if it comes back positive, then they are sent to another COVID unit, which will house all our COVID patients. And those that test negative will then go to a floor that all the other people have tested negative.
What would you say to someone who is afraid to go to the hospital for fear of catching COVID or making their situation worse instead of better?
I would say that there's reasons you come to the hospital, and I wouldn't change those reasons. So for real emergencies, such as people having chest pain that you're concerned about, things like a heart attack, things like people are having numbness or neurological symptoms for concerns of a stroke, they should not delay care. Those that delayed care, and we've seen this months after our peak, that people delayed care and they had very poor outcomes from initial disease presentations that started very early that could have been intervened on in the emergency department or being hospitalized at that point in time. The hospital has taken such large effects and such large measures to make sure it's a clean environment. Every room is cleaned thoroughly after every single patient. UV lights are utilized in patients that test positive for COVID. So there is more thorough cleaning that goes on in each and every of these rooms than most places we encounter. And we know every patient that has gone that room that's positive or not, as opposed to any other facility you might go to where we don't know if the person before us was positive or negative. So if you feel comfortable being able to go outside and go to a restaurant, there should be no reason you should not go to a hospital. And you should definitely not delay your care, because I think that will ultimately harm you in the long run.
Let me ask you a question. A lot of people are sent home to quarantine, and you spoke about the cleaning that goes on in the hospital setting. How should we clean, if you will, if someone is quarantined to a certain part of a home? What will you suggest us to do so that this virus is not spread to the remaining people in the home if you are living with someone?
Yeah, I think that's an important factor, because I think what we saw a lot of is when people went home, because of many people, especially where our hospital serves, it serves on the border of Nassau and Queens, a lot of people who live in apartments live in close contact with family members. So there was a lot of cross-contamination at that time. It's hard to tell someone to quarantine if they're living in a shared bedroom with multiple family members. The best part to do is to reduce the risk of spread is remembering how this virus spreads. It spreads a lot by respiratory droplets. So making sure someone, anytime they're in contact with others, that they're wearing a mask, reducing your risk by other family members wearing a mask when they're around that family member. Anything that is shared, things like utensils, make sure they're washed thoroughly before any use. Anytime that there's an exchange, such as, when someone might use the bathroom, make sure things like faucets or handles are wiped down properly, because this can be clear areas where someone might cough and touch that can spread that. And we're finding more and more how long this virus can live on substances like this. Initially, we thought for days, and I think we're starting to realize that it's probably not as long as we initially thought for it to be infectious. While it might still be there, it's not an infectious, meaning if I touch that and touch myself days later, probably not the same infectious rate as opposed to someone just coughed on it and I touched it. So I think by remembering where the virus can live, remembering to wipe down areas, and then just being cautious of what we would out in the environment, of making sure we wear a mask, washing our hands thoroughly each time, especially anytime before we touch our face or eat, I think can help reduce the risks.
What would you say to someone who is listening and is considering a big holiday get-together, since the holidays are coming up, or someone who refuses to wear a mask when near other people? What would you say to them?
I think it's one of those things that it's hard for people to realize just the effects that they can do by and cause by having by willing to be liberal with their mask wearing or liberal with how many people they're willing to do. I think that until it's affected your family or if you've seen it firsthand, you might not realize those effects. But you got to realize that this is a part where we don't play just for our own safety, but it's for our family's safety. So the reason some people might wear a mask out in public is to protect the loved one at home. And I think we have to be cognizant of our community, that not everyone is going to do well if they contract the virus. There are a vulnerable population that we have to look out for. So wearing a mask is kind of like being in public is part of being part of this community. And I think you want to do the right thing, not for you per se, but also for your neighbor who might be elderly. So you don't want to get them sick. You want to make sure that you can have another family gathering so that, next year can be like last year. And it's not. And so this year might be a little different because of it. It might not be the big family gathering. It might be more virtual gathering. But this way that the same people hopefully can be here next year to celebrate with you. And it's not something you regret come Christmas time.
Has this changed the COVID pandemic, the standard of care in terms of your patients are coming in for a voluntary surgery? Is it automatic that you're doing a COVID testing for anyone who is anticipating surgery, whether it be elective or otherwise?
Yeah, there's been a lot of standards changed. In fact, many places, before they get anything that's considered elective, it's usually they want to, within the past 72 hours, of have a negative COVID test. Of course, all bets are off when it's an emergent thing. We usually test them at the time in the emergency department for any patient that's coming into the hospital. But a lot of elective procedures are being held right now until positive COVID testing, which has put back some tests. Even some. Initially, there was a lot of specialties that weren't seeing patients until they had negative COVID tests, especially certain specialties that had to deal with patients' mouth or nose area, such as an ear, nose, and throat doctor or a dentist who might have wanted those tests back before they would continue their care.
So what would you say for a patient? I know that there's a lot of older adults in the community who cannot really articulate that they have symptoms. How do we protect if you have an older adult in the home that may have symptoms and can't express it? How do we keep them safe so that they are not, if they do have COVID, contaminate others in the home?
Yeah, so I think one of the things is recognizing symptoms early. So recognizing that there's a cough. Fever is always one of those things that's harder to express when someone's nonverbal. But there's a lot of things and devices out there now. I know a lot of people have been buying into the IR guns to check people's temperatures. I think it's also one of the things to notice when someone's just not acting right. This is the same time of year when we start to see a lot of flu, which hopefully because of mask wearing, we won't see. But being cautious of the same symptoms, people being more tired, people just not eating the same way, remembering that it is a virus, so it can present with very subtle symptoms just like that. And just being aware of those things so that, okay, those times we got to make sure that we're taking even extra precautions. You should still take the same precautions and the same things, any shared utensils or anything that something goes into someone's mouth, that make sure that hands are washed, utensils are washed, plates are washed thoroughly before sharing anything like that. And then obviously, again, avoiding any kind of close contact, especially when there's early or subtler signs of possibly a viral infection.
To switch to the protection of healthcare workers, what is the current status of PPE supplies at Long Island Jewish? I know that the governor wants everyone to have 3 months supply at all times of masks, gloves, gowns. How would you say your status is at Long Island Jewish to protect healthcare workers at this point?
So I think we've been very fortunate with just Northwell in general. Northwell has been a very loud voice in this during the whole COVID pandemic. And we've been fortunate enough to always have a supply of the supplies we needed, from N95s to eye shields to gowns to gloves. We've never really run short of that. We've been fortunate because obviously we've heard of stories of other healthcare systems not being haven't been able to plan accordingly ahead of time for this, especially when the outbreak did occur. But right now we've been, we have a great materials manager who's been really on top of all this to make sure we have a 3-month supply and make sure that the supply lines aren't short, and make sure should one of those supply lines be short, that there's always backups. So right now we're actually fairly good, and we feel comfortable that it's not the PPE we're worried about. We're worried about the numbers of patients.
So tell me, how do you feel about the vaccine?
It's a great question. I think I would quote Anthony Fauci and to say I'm cautiously optimistic. I think that there's been amazing headway that's gone with really getting this virus, getting this vaccine for this virus completed, and getting to the point where we are right now, where we're looking at 2 to 3 companies that are having basically a finished product waiting to submit to the FDA for approval. I don't think there has ever been anything fast-tracked as quickly for vaccinations the way this has, which has me the cautious part, because we don't know what long-term effects are. This is a vaccination, some of which is using technology that hasn't been used before. So we don't know long-term effects of this because there hasn't been other studies with this before. Right. So what are the long-term effects? No one can properly answer those questions. How effective is it? We can say probably with what the studies show how effective it is at 28 days. But is this something that wanes like our normal immunity for COVID? For those who get infected with COVID, usually at 28 days later, a lot of their immunity is back to zero. So we don't know if this is something that works great for a month, works great for 3 months, works great for a year, like the flu shot, and then we need boosters. All that remains to be determined, and I don't know if we'll have answers very quickly to that.
Is this something that's being given?
Yeah, currently the vaccination is being given. I know there's a handful of trials going on, but it hasn't been given to the mainstream healthcare or public just yet until it really passes FDA approval for it to be given to mainstream.
I know that with the COVID, now it's peaking again in terms of the schools. And one of our concerns, and I guess most parents' concern, is that should I allow my child to go back? And I know that once it gets to a certain peak, it's going to really be no discussion because those schools will close. What is your thought about, I know the transmittability of the COVID, but having the children go to school with this pandemic being the way it is and the way it's resurging, what would be your suggestion to parents?
It's always a tough thing because it's not alone just a healthcare decision. We know that kids probably, if they do get infected, usually don't have as severe symptoms as adults. So they might get a cough, they might get fevers. In some cases, they've gotten rashes, but and then in very, very rare cases, they got overwhelming inflammatory conditions. But there really hasn't seen the same numbers and mortality as we have in adults. With that being said, that same virus can be brought home to older parents or grandparents and affect them. But it's not just a health concern when you consider school. There's also a lot of social concerns because families might need to work and they might use school as a way to take care of their child for the day. And if they don't work, then they can't get food, which becomes another nutrition issue and health issue. So it's a hard question to answer a yes or no. I would say that obviously we look at other countries and they've really worked hard to keep schools open longer than they've kept restaurants open. And I think that they felt that was the most important thing to focus on, and the safety of schools. And I think a lot of the Board of Education has really worked hard to find ways to keep the schools safe, both for the children as well as for the teachers. But at the same time, obviously, there's going to be outbreaks. And what do you do when that occurs? And try to keep those close in contact with the person that was infected. Try to keep them on quarantine for a little bit and then go back to what they can of reopening the schools, I think is going to be the best advice, just like we've done with a lot of other places. I think schools are important, both because you realize how disruptive it can be for a child's education to go back and forth between I have school for a few months and I'm out for a few weeks, back for a few months. We want to make sure that that's not as disjointed as it has been. And we also want to make sure that they don't lose out. There is a lot to be said for technology, but I think that some of the early studies have shown that virtual learning hasn't panned out as well as they thought it would be, as opposed to in person, because it is more interactive and you engage the child at all levels a lot more when it's in person. So I would say we want to keep people in school. We want to do our best because of the other social ramifications that can occur if we don't. But we got to make sure it's safe and all the precautions are taken to prevent children getting sick, but more importantly, children are bringing that disease home.
What is the one thing you want to leave our audience with when it comes to how Northwell Health is handling the pandemic increases here on Long Island? So
I think as we can see with New York State, we've seen our CEO of Northwell, Michael Dowling, sitting at the table with a lot of the decisions being made with Andrew Cuomo and our governor. I think Northwell is at the head of the healthcare industry in helping make these decisions, at helping do the research on what's right for COVID, but also making sure we have a safe place both for patients to be seen and for for practitioners to take care of patients. Northwell has gone above and beyond to take care of their staff and make sure all our staff are taken care of. And, it came to a point where I think, our CEO said, whatever the cost, make sure that our people are protected, that there was enough PPE, that we had enough of the staff to do what we need to do, which was our primary focus, which was take care of patients that needed it.
Well, thank you so much for being here, Dr. Frederick Davis, the Associate Chair and Physician in the Emergency Department at Long Island Jewish Medical Center, which is a part of Northwell Health. We hope you have a safe and continue to do the great work you're doing. And thank you so much for being our guest today.
Thank you very much for your time.
This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, along with student Gina Peter. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.